Hi everyone, it's great to be here. First of all, thank you to the organizers for this wonderful platform to speak about our initiative. I'm a PGY4 at Northwestern. So today I'm presenting our results on the pilot needs assessment study that was conducted to study the current status of education and training in radiation oncology during medical oncology fellowship. As you all know, oncology is a truly multidisciplinary specialty, and there are so many advantages of a robust and adequate education interdisciplinary education. Some of them are listed here. It leads to improved communication, improved coordination. There's greater consensus at multidisciplinary tumor boards. There are more timely and appropriate referrals. And downstream to all of that, ultimately our patients stand to benefit from all of this. This is an interesting study that was done by Dr. Tim Cruiser at our institution, where he looked at the perceptions of medical oncologists towards radon as a participant in discussion of end-of-life planning in patients that they're sharing, and these patients have advanced cancers. So they were able to recruit 31 medical oncologists from a national cohort, and they conducted 4 focus group sessions that were moderated by professionals. The moderators had PhD in medical sciences education, and there were some very interesting conclusions from this focus groups. Some of them are listed here. Radiation oncologists were compared to surgeons as basically physicians who provided a finite intervention therapy but lacked any longitudinal patient contact or relationship. Medical oncologists expressed concerns about the capabilities of radons to accurately prognosticate the patients and mistrusted radon's knowledge about available systemic therapies. There were some comments that radiation oncologists are not really oncologists. And I know this is a small group and may represent just minority opinions and biases, but in the context of this study, it became very clear that medical oncologists do need some education and exposure to our field. And ultimately, it's our responsibility to make sure that happens, and we thought what better place to start than at the trainee level. So we devised, going back, So we devised an anonymous red cap-based survey and distributed those to the 3 Chicago area academic centers, Northwestern, University of Chicago, and Loyola. We asked the fellows about their training during 3 years of internal medicine residency, the training that they were receiving during fellowship. We asked them about how comfortable they are in knowing when to call for consults for radiation oncology during various settings, if they felt confident in knowing how to manage and follow patients who've had radiation, and also how interested they were about learning more about radiation oncology. This is just a sample of some of the questions. We also used 5-point Likert type questions to assess for interest and needs. So currently there are 42 medical oncology fellows in these 3 institutions, and our response rate was excellent, 85.7%. And here are some of the results. We asked them if they got any training in radiation oncology during their 3 years of internal medicine residency. And these are residents who are clearly interested in oncology, and they ultimately went in to do a fellowship in medical oncology. And not surprising, over 50% said that they got 0 training in radiation oncology, and only a minority, 13%, said that they actually did an elective or a required rotation, and some of them had 1 or 2 lectures at most during internal medicine residency on radiation oncology. We also asked them if they were currently getting any education or training in radiation oncology, and 66% responded yes, although 34% said they hadn't received any training, which is concerning. We asked them to further elaborate on what their trainings were. And only 20% said that they actually did a formal rotation in radiation oncology, and 80% their training was limited to maybe one, most of them one, some two lectures during their whole fellowship training. We asked them about their interactions with radiation oncology during fellowship. Most of them said they had some interaction, which was defined as basically getting on the phone and calling for a consult for radiation oncology. And only 30% said that they had significant interaction. They basically worked with a round team to come up with a plan and deliver care. So overall, there were 5 residents who did a formal rotation in radiation oncology during their residency, and 5 out of 36 fellows had done a formal rotation during fellowship. Good news is that 78% were very interested in doing a rotation in radiation oncology and thought that that would help. We asked them how confident they were in knowing when to consult radiation oncology in different settings. Majority of them do feel very confident, or they feel confident at the setting of a newly diagnosed cancer. There were about 30% who did not feel confident over here, and about 40% who did not feel confident during emergency situation. But it's good to see that majority of them do feel confident that they know when to consult radiation oncology. We asked them how interested they are in learning about radiation oncology, specifically when to consult radiation oncology, learn how to follow patients after radiation therapy, and just interested in knowing how radiation therapy works. And as you can see here, over 70% were interested to learn about when to consult radiation oncology. Over 90% were interested to learn how to follow patients after radiation. And again, here you can see over 70% were interested. We also asked them what kind of topics they would like to be covered during their lecture series, and there were 2 major topics. One was relating to the side effects and toxicity of radiation therapy, and the other pertained to the technology of radiation oncology. More specifically, they wanted to know how to manage and follow patients, what to look out for specifically during concurrent chemo-RT, what were the organ limits for radiation therapy, issues about re-radiation, and on the technology side, they were interested in knowing, when 3D versus IMRT versus proton therapy were used, how we determine fractionation, how doses are determined, and how radiation therapy works, the basic physics and biology of radiation therapy. So in conclusion, clearly there is a need to develop a structured radiation oncology curriculum for medical oncology fellows, and that can also be translated to other oncology subspecialties. And most importantly, there is an interest among medical oncology trainees to learn more about radiation oncology. So future directions, we hope to develop and implement a formal curriculum at the surveyed institution, collect feedback, and the ultimate goal is to be able to implement this nationwide. If any of you have any ideas, please feel free to share them with us. With that, I would like to thank everyone who participated, all the centers, Dr. Golden, Dr. Harkenrider. Thank you all for your participation.